Hello, hello, and welcome back to Retrieving Sanity with your podcast host, Keegan. And this is your podcast for all mental health, addiction, recovery issues, and topics. And today we have a very special guest, and his name is Dr. Fred Schiffer.
Hello.
So, it's great to have you on. I was reading all about your book of Two Minds and your working of dual brain psychology, and it's just super fascinating stuff. So I'm like just super excited to talk to you about all that stuff. But can you fill me in a little bit? Like, what's your background like? Where are you from? What got you into being a psychiatrist, being a doctor?
Uh-huh. Okay. Uh, well, I was born and grew up in Atlantic City
Ah,
before casinos, and it was a small town then, and went to college at the University of Pennsylvania and medical school at Hahnemann Hospital, where I did internal medicine, and then I came to Harvard to do cardiology and studied stress and heart disease, and
mm-hmm.
then decided to round out my education and went into psychiatry at Harvard, McLean Hospital, where I did a residency, and and then I found that the cardiologists, the cardiac patients weren't interested in a psychiatrist. and but I really enjoyed psychiatry,
Mm-hmm.
and and I was always interested in research, um, and and I then developed from my observations and reading this theory called dual brain psychology, which has a
Mm-hmm.
number of applications and which is probably what we'll talk about today.
Awesome.
Uh,
Um, you have a really extensive background, and I mean, just hearing all of that is really impressive because a lot of people kind of just choose one career path and just kind of gun with it, and
mhm.
you kind of went and then branched off to all these different things, and you landed in psychiatry, which is awesome because I think that that's one of those fields that needs innovative people, that needs people to sit there and actually strive for the better. And that sounds exactly what you're doing,
Yes.
because you've got two books, correct, of Two
Hmm.
Minds,
Hmm.
and then your brand new one, right?
Yeah, here's my brand new book. It's called Goodbye Anxiety, Depression, Addiction, and PTSD. So that this theory addresses all of these issues, and I'll explain why.
Okay.
So this is available on Amazon, and and takes off uh, from where the first book left off.
Ah,
Mhm.
okay. So, for all of us out here that don't really know what dual brain psychology
Right.
is,
Hmm.
what is it? Because I mean, I have one brain, right? It's up here in my
Uh-huh.
cranial
Right.
region, and it's just one thing, right? So it controls everything, and but it's just one, right? But you're saying dual brain is in two.
Yeah. Actually, I would say that you have two brains in your head, and
Okay.
um, and um, this was revealed um, um, in the split brain studies that won the Nobel Prize.
Oh
And
wow.
these were studies that were done on people with intractable epilepsy. And as a
Huh.
desperate move, first in the 1940s and then in the 1960s,
Hmm.
there was a radical surgery that was done where they cut the connection between the left brain and the right brain.
Oh wow.
And it turns out that the left brain and the right brain are pretty complete brains. You can remove a hemisphere, or that's what the left and right brains are. They're called hemispheres of the
Hmm.
brain. And someone might have cancer, or have a stroke on one side and wipe out a whole hemisphere. And they, um, um, if they survive the surgery and the stroke, you can communicate with them, and they're a human being.
Hmm.
If you lose more than a hemisphere, then you're not really able to communicate, or you're not recognized as a person. Um, and so
Huh.
the what these When they cut the connection between the left brain and the right brain, what they found was that uh, there were two people in there, and
Hmm.
one, for example, one person wanted to smoke, and his other hand kept putting the cigarettes out, and so one brain wanted to smoke, and the other brain, the other hemisphere, did not want to smoke. Another woman chose a dress to wear, and she's trying to button it and put the dress on, and her other hand was unbuttoning it.
Oh, wow.
And um, It
Hmm.
turns out that the eyes are connected to an interesting way to the brain, such that if something's shown to the I'll put my book up here, so to the left visual field, in a
Hmm.
split brain patient, he has language in his left brain, and
Huh.
but the image actually goes only to the right brain if it's shown to the
Hmm.
lateral visual field.
Hmm.
And so in this one patient, they showed a picture to the left side of her, and it was
Hmm.
only seen by her right brain, which can't speak. It
Hmm.
understands language, and the woman started to giggle, and they asked the left brain, which can speak, why she was laughing, and she had no idea. And Roger Sperry, who's this very distinguished Caltech professor,
Uh-huh.
had showed the woman a Playboy nude to her left lateral visual field,
Uh-huh.
and her right brain thought that was very funny. I was giggling, and her left brain had no idea why she was laughing. Uh,
Wow.
and so
Huh.
in From the split brain studies, we did find that if you cut the connection between the two brains, you've got two different people.
Huh.
And um, After a couple of months, the left brain takes over and dominates, so that you don't see this kind of interference and obvious competition between the two sides. So I was interested in that because I was seeing, instead of the id and ego and superego that I was taught about, I wasn't seeing that as much. I
Hmm.
understood what they were as
Yeah.
concepts, but what I was seeing was that my patients came in, and they had sort of an id-like personality that was
Hmm.
conscious. The Freud's id is supposed to be unconscious,
Uh-huh.
and but they were impulsive and childlike, and having a lot of id qualities. And then as they got
Hmm.
better, they developed more ego qualities, and they were more mature and intelligent and better behaved, um, and then something would upset them, and they'd revert back to the immature side. And then as they got better again, they became mature. And I got this idea that they were, in ordinary people, two
Hmm.
minds. And
Okay.
and then as I reread the split brain studies, I wondered whether there was some connection, but I didn't know, what to do with that.
Hmm.
And then I read a some articles by a German group that were showing
Hmm.
movies of somebody getting shock treatment
Hmm.
to one side or the other. And again,
Hmm.
they're they had a very expensive, complicated machine, and it was hard to figure out how they were showing a movie to one brain or the other in normal people.
Mm-hmm.
But what I figured out was that they were showing it to the lateral visual field. They were tracking
Mm.
eye movements and masking a computer screen, and uh, and I figured I could do that on my budget by going like this, just looking out of one lateral visual field or like this.
Uh-huh.
And
Yeah.
so I went to the office. I didn't respond. I didn't feel any different. Uh, but I went to the office and I asked my
Mm-hmm.
first patient to try it. And he was a Vietnam vet with PTSD who was doing quite well,
Mm-hmm.
and he was looking out his right visual field, which would stimulate his left brain,
Mm-hmm.
and and he got all upset, and he said, "That plant behind you looks like the jungle." I said,
Mm.
"Really?" I said, I realized he was having a flashback,
Mm-hmm.
and I quickly said, "Well, try the other side." And he smiled and got relaxed, and he said, "No, it's a nice looking plant." And
Wow.
and several patients that day had similar, really intense responses.
Huh.
And I find in my practice that about 55% of people in my practice have these intense responses. Someone might come
Mm-hmm.
in with alcohol cravings
Mm-hmm.
and or gambling cravings or severe depression, and I can have them take an envelope like this and again block their eyes like this.
Mm-hmm.
So we've gotten more sophisticated. So instead of using your hands, you now use an envelope, and I have special sunglasses that you can wear for a while and have the
Oh.
same effect. And
Huh.
so about 55% of people can have dramatic differences depending on which side they're looking at.
Mm-hmm.
And so one patient uh, had come out of an alcohol rehab, but he still had cravings for alcohol.
Mm-hmm.
And I said, well, I might have a beer in my refrigerator, um, uh, but it's expensive. And I said, how much would you pay me for it? We had an auction. So he was willing to pay $500.
Oh wow.
But after he looked out his good side, he didn't want to pay me anything. And
Wow.
I said, well, I'll give it to you for free. And he didn't want it.
Oh wow.
Uh,
Huh.
and so I see these kinds of amazing responses every day. It's
Huh.
not like a rare thing. And
Yeah.
then so that's about 55%. And then about another 30% might have like on a 10-point scale, maybe a 2 point difference.
Huh.
Uh, and um,
Wow.
and that's useful
Mm-hmm.
to uh, um, it's a useful difference in that I can
Mm-hmm.
it's enough of a difference that I can see two different people, so
Yeah.
they're not as extreme,
Mm-hmm.
and so the purpose of dual brain psychology is to talk to the troubled side, and the
Okay.
troubled side is always troubled for the same reason. It's called trauma. And the trauma is usually unrecognized and unappreciated,
Mm.
and
Oh.
and it can begin with maybe a mother who's hypercritical. Maybe she was
Mm-hmm.
traumatized, and
Mm-hmm.
and so um, uh, uh, the patient may then go to school after he's had
Mm-hmm.
some insults at home, and then he can't pay attention, and he's told he's got ADD, and then that becomes a trauma,
Mm-hmm.
and he has trouble getting along with his peers, and that becomes a trauma, and then he
Mm-hmm.
gets into alcohol and bad peer relationships.
Mm-hmm.
And that becomes a trauma, and then he becomes a drug abuser, and that's a trauma.
Uh-huh.
And um,
You can take that if you need to.
I'm sorry.
Oh, I just heard your phone go off. I didn't know if that was important or not.
Oh, okay. No, I actually that was someone else's
Oh.
my wife's iPhone. I'm sorry.
Oh, you're good. You're good.
Actually, I didn't know where that was coming from. Um, um, so um,
The
uh,
unrecognized trauma. Uh,
yeah. So when the patient comes in, so they have a drug addiction or
mhm,
alcoholism, their concern is that they're an alcoholic.
mhm,
And I like to say I don't have any alcoholics in my practice or any drug addicts in my practice. I
mhm,
have people who were traumatized and
mhm,
turned to substances for relief.
mhm,
And it may not be a good idea because it's a little boy in there or a little girl, trying to
mhm,
decide, how to help themselves. And usually those solutions aren't uh, uh, productive,
yeah.
and so their solution winds up becoming a greater trauma. But
Mhm,
it winds up that there's trauma in one brain hemisphere and
mhm,
not so much in the other. The other is sort of developed later and is a lot healthier. And
uh-huh,
so I try and get the healthy hemisphere to be a co therapist. And we try
hmm,
and help the traumatized side appreciate that uh, that he was traumatized or she was traumatized, and it really
mhm,
isn't her fault or his fault, and
mhm,
and uh, and it leads to a different understanding of themselves. And
mhm,
we try and get the traumatized, immature side to become healthier, and
mhm,
and uh, and get the two sides to cooperate rather than try and dominate each other and sabotage each other.
mhm,
And, and it's very interesting that the two sides, you're saying, you've got one brain. Well, I actually, you've got one brain, each with divided with two hemispheres, and each hemisphere
mhm,
has a mind of its own.
uh-huh,
And sometimes one mind, like in someone who's addicted to heroin or fentanyl, uh,
mhm,
their positive hemisphere is so suppressed that they don't even know that they have it,
mhm,
and bringing it out in my office is the first time that they've felt that or seen that.
oh
And
wow,
then later, I wanted um, a way to stimulate the positive hemisphere more strongly
mhm,
than I can with the eyes, although the eyes are pretty strong.
uh-huh,
And so I went to the Wellman Center of Photomedicine at MGH,
okay,
and and we came up with. I knew that near infrared light goes through the skull and into the brain,
mhm,
and and so I sort of made a cold call to them, and I got passed around, and finally was put in touch with a guy named Mike.
okay,
And Mike seemed to be interested in this idea. The other people, said, "Well, it shouldn't cause any problem," but they just weren't that interested. But Mike was interested, and it
huh,
turned out that Mike is Michael Hamlin, who's the world's authority on what's called photobiomodulation,
huh,
which is the application of light to the body.
mhm,
And he's written about 13 books and about 300 plus papers
wow,
and so we did the first study using transcranial light
mhm,
uh, um, um, uh, on patients with anxiety and depression. And they also
mhm,
had a number of them also had a history of addiction. They weren't actively addicted at the
mhm,
time of the study, and they did remarkably well.
huh,
And um, so then I was applying the light to the positive hemisphere,
mhm,
and and got really remarkable results, sort of like I did with the envelope or the hands in my practice. But now the response was about 2 or 3 times more intense and lasted longer.
Whoa.
And and now we've gotten 2 grants from the National Institute of Drug Abuse, and
Ooh.
right now we're running a study for fentanyl addiction, where we're applying the LED. The light is in the form
Mhm.
of an LED, and it
Okay.
has no known side effects. And the FDA has declared that it has no significant risk.
Huh.
Um, um, and I don't know. Half the group in this study are getting a sham treatment, and half are getting an active treatment. But a lot of the people in the study with fentanyl addiction are doing
Mhm.
very well.
That's awesome.
And it's a 6 month study, um, so I don't know whether they're getting the sham or the active treatment, but a number are doing quite well. And in our earlier study, we
Mhm.
studied opioid cravings, and this was before fentanyl. Uh,
Oh.
and and we got a 70 something decrease in cravings in 4 weeks of light treatment in the active group, and a 35% decrease in the
Huh.
sham group.
Wow.
And statistically it was off the chart.
Uh-huh.
And in this study, it's a longer study,
Mhm.
uh, and maybe because some people are stop using fentanyl, but
Mhm.
it looks like it's sort of transformed their whole life,
Wow.
and they're really doing better. You know, they came in kind of rough and injured,
Mhm.
and by the time they leave the study, they're smiling, and a number of them are have gotten jobs,
Oh
so it's
man.
really transformed some lives, and it's very exciting. It's going to take us uh, probably and maybe another year before we get the data analyzed and ready for publication. Uh,
Wow. Holy cow.
So, and also uh, uh, I've found in my practice that it's very good for depression
Mm.
and anxiety. Actually, for anything uh, that comes out of trauma, because what
Mhm.
we're really treating is trauma by
Mhm.
stimulating a more positive hemisphere that's less traumatized.
Yeah.
And so it's what's called multi-diagnostic. It
Huh.
treats a whole range of uh, problems, sort of like ketamine.
Mm. Wow. Um that is I don't even know the word for it because that's just way too cool. Um
Yeah, if you like, we can try on air. If
yeah.
you have an envelope handy, we can have you see if you get a response or not.
Yeah, so I was actually going to say, like, can we try this? And I
Yeah,
had a question or two beforehand.
sure.
Um, so whenever I personally did know that the eyes speak to the opposite side of the occipital lobe,
Right.
and but that's just because I was going to school for paramedicine and stuff. But that's all long gone thanks to alcoholism, you know. But one of the things that I've noticed ever since I was a little kid is that one of my eyes sees colors just slightly different, and I've always kind of noticed that depending on which uh, one I'm really focusing on, because I can also focus which eye I'm looking out of. I
Uh-huh.
do notice a little bit of a change up there, but I didn't know if that was like an actual thing. But the color thing is what throws me off because, like, I forget which one it is right now, but one of them sees things in a brighter hue, if that makes sense, and the other one is like darker. Um, do you have anyone like talk about that? Because
Uh, I don't know what that means.
that might just be my eyeballs, not my brain.
Yeah, yeah. Well,
Okay.
right, and that um, uh, that if you look out the whole eye,
Mm-hmm.
the impulses go to both hemispheres.
Mm-hmm.
So if I show a picture, if I just cover one eye,
Mm-hmm.
um, it goes more. It's 60-40. It'll go more to the opposite brain,
Huh.
but uh, uh, but it goes to both hemispheres, so you don't see a big difference. So what
Okay.
I do is have the person look out the lateral visual field, which is to cover one eye and half the other eye. So I'm looking at
Uh,
the lateral half of one eye on this side or this side. And
so
if I could share the screen, I can show you
yeah.
an image of an fMRI study that we did at McLean Hospital at
Yeah.
Harvard.
Yeah. And uh, I think you can share screen.
Okay, let me see if I can do that.
If you can, cool. If not, might be able to. Let's see. Hmm. It should be at the bottom if it's there.
Let me see. Yeah, here, this is. Can you see that? Uh,
Uh, not just yet.
you don't. Okay.
Let's see. Share screen. See, I can share my screen, but I can't.
Okay. Well, basically, what I was going to show is a study that we did at McLean, where we
Okay.
had people in a scanner, and there was tape in the middle of a safety
Mm.
glasses, and so
Huh.
they looked out one side. They were looking out their right lateral visual field or their
Mm.
left lateral visual field, and the opposite hemisphere lit up like a Christmas tree
Huh.
uh, and and uh, and they just switched which side they were looking at, and the hemispheres switched. So
Hmm.
we have, and what an fMRI does is
Mm.
it measures blood flow in the brain, which is
Mm.
a good measure of brain activity. So that this simple technique with a piece of junk mail um, actually affects the physiology of the brain
Huh.
and stimulates the hemisphere very broadly. It
Okay.
stimulates the whole hemisphere.
Huh. That's really interesting. And it's just the way that the wires are in the brain, right? Just one goes this way and one goes that way, right?
Yeah, yeah.
Huh. That is really cool that it just for some reason I that doesn't make sense to me. It should just be look straight and forward and backward, but no, they crisscross. Um is there
But that's part of the way the whole nervous system is. In other words,
mhm.
that if someone has a stroke on the left side, they get paralyzed on the right side, and
Mm.
and that most of the brain crosses over to the other side for whatever reason. I don't.
Huh.
Uh, uh, and with the eyes, as I said, each eye actually goes to both brains,
mm.
but the lateral half of the eye, it's actually the medial retina crosses
Mhm.
over to the opposite brain, and this is what Roger Sperry used in his studies,
Mm.
and 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 so it's what I used in my studies,
Okay.
and we have about 30 publications, and
Wow.
dual brain psychology is the first psychological theory, including Freud and Jung, that comes out of rigorous scientific research and is supported by rigorous scientific research. that this isn't just an armchair discussion.
Uh-huh.
That at McLean we've done rigorous EEG studies, and we use a great deal of high tech ways of monitoring brain activity,
Mm-hmm.
and we also have clinical outcome studies,
Mm.
so uh, so it's a well researched area. Um,
Okay. That is really cool.
uh, so if you want to try it, it's up to you.
Yeah, yeah, yeah. I got my book
Okay.
ready.
Okay. Yeah, look out. You got to do it for say 20 seconds on one side. It happens very quickly.
Okay,
And
so
maybe think of something upsetting, and not crushingly, but so that we can provoke a response a little more, and look out one side and measure your distress from 0 to 10.
okay. Um okay. So and then cover one side and look out.
Yeah, so cover one eye and half the other eye, and but it's important that is half your eye. Good. Okay, and then think of something upsetting, and then. So how upset would you feel from 0 to 10?
Like a one?
Okay, now try the other side.
Huh.
What would you say?
That it I can't I think it dropped cuz it I can't tell. Hang on, that was weird cuz I felt a drop, but I don't know if that was huh. Let's see. Let's try one more. I want to try a different thought. Um, okay. Okay. Yeah. So covering this eye actually made everything seem like it dropped.
Uh-huh.
So covering my right, so that means my left side was getting the information which was going to my right side,
Right.
correct?
Hmm.
So is there uh for each person is it different which hemisphere is the healthy
Yeah, that's
one?
right. We have to test. In other words, when we use the light,
Uh-huh.
we don't know which side to put it over until we test them with the eyes.
Ah.
And so if your left brain is your more positive side,
Mhm.
then we would put the light over your left hemisphere and put
Mm.
it in the corner here, which is over
Ah.
what's called the dorsolateral prefrontal cortex,
Mhm.
which is a major hub,
Mm.
an association area of the brain,
Uh-huh.
and we feel that it stimulates a different personality.
Hmm.
If we put it over here, so it would be sort of like the difference that you feel with the envelope. But how many
Mhm.
points on a 10 point scale would you say the difference was?
So the first one, you said not too crushing, so I thought of something that wasn't terrible.
Yeah.
And so that's why it was kind of like already at a one because I was like, it's not going to be too bad. But then
Hmm.
the other side was like, okay, it was like essentially gone.
Hmm.
Um, and then the other one, I thought of something much more distressing, And so I would say that that was probably at about an 8 or a 9,
Uh-huh.
because that would be like something really big. But then switching it over, it was probably like a 4, 5 maybe. Like
Hmm.
it wasn't gone, but
Right.
it was definitely a significant drop of like I could feel the tension that I had built up kind of just release a little bit. It wasn't all the way gone, but
Right.
I could definitely feel that there was something a little bit more relaxing in it.
Hmm.
Like kind of like
You
I
could bear it more.
yeah, exactly.
Hmm. And if that were like drug cravings,
Mhm.
that if it were an 8, the person would be uh, on the phone, calling the dealer. If it were a 5, uh, uh, probably not.
Calling their
They
sponsor.
probably could bear that.
Yeah.
And so it could make a difference between whether someone engages in something that's going to be harmful,
Mhm.
or makes a decision to do something that is more constructive, and
Mhm.
and um, and also it's useful to show a person who's been very depressed that
Mhm.
they can feel well for the first time, and 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 sometimes we have an issue that the negative side it gets upset and
Mhm.
says, well, you want me to retire and go out on disability? Well, the hell with you, and so we have to negotiate with it and talk with it,
Mhm.
and that becomes an important part of the therapy.
Mm. So now that we've essentially figured out that there's two of me inside of
Yeah,
me,
right.
um how does one go about making the healthier side be the co-therapist? Because you're sitting there essentially saying that the healthy side is going to be like the best friend to the other side, or
Yeah,
maybe like a mentor of sorts or something, right?
yeah, like a good parent.
Okay.
Yeah, and so sometimes you have to say to the troubled side, "Hey, listen, knock it off. You're interfering with me, right? I don't want to use drugs today.
Uh-huh.
Get in the back." And other times you need to be loving and say, "I know you're really upset, but I'm here to help you."
Mm,
And I care about you, and I want you to work with me,
mm,
and stop trying to sabotage me and take over. That we're not going anywhere if you're leading,
mm-hmm.
and if you help me, uh, then we can work together and sort of like a corporation, that we want to take you out of the corner office and
Mm-hmm.
make me the president, but you can be in charge of marketing
Uh-huh.
and or some other important function, but
Mm-hmm.
not making the critical decisions because uh, you have an injury and uh, you're not as well developed and as
Mm,
mature,
yeah.
that so they're different roles, and that's okay. It's like a
Mm-hmm.
parent is should be if the parent's a healthy person, able to make better decisions than a child, and
Mm,
should guide the child. Now, unfortunately, that's not always true. A lot of parents are very traumatized and destructive
mm-hmm.
with their children, and there's a lot of abuse, whether it's spousal abuse or child abuse or
Mm-hmm.
uh, and I think with all of the patients that we're treating on fentanyl, they all have severe trauma histories,
Mm-hmm.
and it's my opinion that the epidemic of opioid abuse and also alcohol abuse
Mm-hmm.
stem from uh, uh, traumas that are uh, not addressed properly, because it's
Hmm.
hard to address trauma.
Yeah.
And um, but um, the essence of what we're trying to do is let the injured part of us uh, know uh, that they need to be understood, and
Mm.
they need to stop blaming themselves, and that when children get abused, they blame themselves. They blame
Mm.
themselves for everything,
Yeah.
and that becomes a trauma.
Hmm.
And that we want the traumatized part to be able to cry and be able to
Hmm.
bear and grieve what happened to them,
Hmm.
and use that grief to recover,
Yeah.
and join the healthier side to build a healthier personality.
Mm. That is, uh, I just love that concept because it's self-helping self in
Mm-hmm.
a different kind of way. Because a lot of self-help books and stuff, like I've read about your inner child and stuff like that, which makes sense.
Mm-hmm.
There's definitely that aspect in myself that I can see, but I also have noticed that there's the more adult-y version.
Mm-hmm.
But sometimes it feels like that one is still on the precipice of like teetering
Mm-hmm.
right there. But I also have that history of alcohol and drug abuse. So that would have been like, this would have been amazing had I known about it years ago, had this been available and known about years ago. So I can only imagine the great amount of work it's going to do for all your patients, all the people in the study, all that. And it's just super fascinating that one side is the one that's essentially, it sounds like it's a sponge for the trauma,
Mm-hmm.
and the other side is the side that's getting ready to take care of the other side later in life.
Yeah, if it's allowed to,
Oh.
and that oftentimes the troubled side, sort of like um, a troubled person, that they can be troubled, but they still want to lead, and they still want to dominate,
Mm-hmm.
and so that's an impediment to recovery.
Mm-hmm.
And also, I don't like the term recovery, because it
Mm.
implies that you can never get better,
Uh-huh.
and that I don't like the term alcoholic. Like,
Mm-hmm.
hi, I'm Fred, I'm an alcoholic. No matter how you spin that, it's an insult, uh, and um, and it's sort of like uh, uh, um, hi Fred, I'm an American, say, uh, and it's an alterable characteristic. Whereas
Mm-hmm.
if you think of it as trauma related, well,
Mm-hmm.
then it's not inalterable. It can
Mm-hmm.
be addressed, and a person can understand the trauma
Mm-hmm.
and recover from it to the point where they're actually healthy,
Mm-hmm.
and don't have to feel that they're temporarily in recovery and always
Mm-hmm.
on guard for when they're going to slip.
Yeah. And that's one thing that I've noticed in the rooms is that some people say that that is who they are, that's who they'll always be. And then you have other people that have that same line of thought that after you properly do everything, you're essentially recovered.
Mm-hmm.
And some people say that they're a little bit of both. Like they know they still have issues to address, but for the most part, they're better. And so I see this interesting dynamic in the rooms, especially the ones that I attend. But the one that, like you said, it is kind of an insult because I see a lot of people will take that and make that their identity. And as you said, it's more of a characteristic.
And,
And
and I'm not saying that if you understand that trauma is causing this,
mm-hmm.
that you don't have to be cautious or careful,
Oh yeah.
because you do have this injured part that can be re-injured,
Mm-hmm.
so there is a vulnerability,
Mm-hmm.
um, but uh, that understanding that it's due to trauma, and not your genes and your
Mm-hmm.
brain chemicals, and uh, that we have brain chemicals, but they
Mm-hmm.
respond more to our experience than our
Mm-hmm.
experience is coming from our brain chemicals. You know,
Mm-hmm.
maybe a little bit of both, but I think experience is what drives everything.
Yeah.
And
I would
so,
have.
so my point isn't that anyone who's had a serious addiction problem doesn't have to worry about it anymore.
Oh
I'm
no.
not saying that, but I'm saying that you can have a new understanding that it's
Mm-hmm.
not um, uh, untreatable
Mm-hmm.
and irrevocable.
Mm-hmm. Yeah. And I do apologize. I didn't mean to make it seem like
No,
you were
no.
going that way. I just do know I hear some people say I'm recovered
Hmm.
because they
Yeah,
claim to not have those cravings. But I was about to say, like you were saying, there's that part of you that's still injured. And I would equate that to kind of like rolling your ankle. Like it's hard to do it the first time, but once you do it, it's super easy to happen again. Um,
hmm,
and the brain is, or like my ego is the same way. Like it can be really bruised really easy, and then uh how I deal with it though is way different than I used to deal with it a long time ago. So I can equate that to learning a whole bunch of stuff, growing in a whole bunch of different areas I didn't know I'd be able to. But I'm wondering if somehow I've been using that part of the brain to help the other part.
yeah,
And you're just figuring out a way to uh, fast track it, essentially.
exactly.
Okay,
Right.
that is way too cool. And so you said it's going to take about a year for all the data analysis to be finished
Yeah,
with
we're
everything.
still enrolling people. We have to study 130 individuals for
Oh
six
wow.
months,
Uh huh.
and McLean Hospital is one site, and I have another site in Newton, Massachusetts,
Oh wow.
so we're each doing 65 individuals, and uh, so we'll finish all of our recruiting by March, and then we'll have people that we have to that'll be done the study in August,
Uh huh.
and then the statistician gets the data, and that'll take a few months, and so it'll be about a year before we get the data from the statistician, and then we want to. We have what's called a breakthrough designation with the
Mm.
FDA, that they were
Oh.
excited by our first study on cravings,
Mm-hmm.
our aim is to be the first uh, device, which is this light, to be used for addiction,
Mm-hmm.
so that's what we're hoping for.
That is.
But it's a long process.
Anything dealing with the government takes a while, right?
Yeah.
But I mean, it does go through rigorous testing because, well, you got to avoid
Yeah,
snake
you want
oils
to
and.
demonstrate that it's
Hmm.
effective, and
Yeah.
half of the people in the half of the participants in the study are
Hmm.
getting a sham treatment, a placebo treatment,
Uh huh.
and so what we do is we compare the active treatment with the placebo treatment,
Hmm.
and in the first study there was a huge difference
Uh huh.
between the two
Yeah.
at both sites at McLean and the site that I was running.
Wow. And so that really just goes to show that it is a legit thing that is going on,
Yeah,
and it's measurable, it's traceable,
that's
it
right.
is 100% legit. That is way too cool. So my question is, whenever the data comes out and everything and it's proven, like is this going to be a technique that is brought about like all over the country and the world and stuff.
Well, I'd like that to happen.
Uh-huh.
I think that my experience in my private practice
Mm,
and what I'm seeing in the study, where a lot of people are getting well, and maybe they're getting well with the sham treatment. I'm blind to that, but
uh-huh.
I think it seems to me that it might be hard to fix someone with fentanyl with a fake, with a placebo light.
Yeah.
But maybe and there probably are some people who are getting better with the placebo.
Mm,
But I have to. I'm hoping that our device is a powerful intervention for people.
okay. That is, well, I can't wait until I start seeing and hearing about it because
And again, in my book, if I hold up
uh
again,
yeah, yeah.
um, this talks about a lot of research that I haven't had time to talk about, and the research is talked about in easy to read and understand ways. It's not this is not a heavy read. It's
Okay.
intended for ordinary people,
Sweet.
and it can be helpful to for any of these disorders. And I don't like to use diagnoses
Mhm.
because I think that. Um, Again, I think trauma is the cause for uh, psychological distress, and the
Mhm.
distress can come out as anxiety or depression or both,
Mhm.
or inattention. Um, so I think all of these things come from traumas that are forgotten about
Mhm.
and need to be appreciated and worked on.
Yeah. Um, and so for those that are going to be listening over the radio,
Mhm.
your book is called Goodbye Anxiety, Depression, PTSD, correct?
Uh, yeah, pretty much. It's a goodbye anxiety, depression, addiction, and PTSD.
Ah, I
The
missed it
life
before.
changing science of dual brain psychology.
All right.
And it's available on Amazon.
Sweet. We'll make sure to include the link to that book with the episode description and everything. And for those listening, you can check out Retrieving Sanity on Spotify, YouTube, Facebook. We'll have the link for his book there. Uh, and just, I know that you had said it yourself. We don't have enough time to cover everything. This is a huge topic. We could go down several different rabbit holes, and just this is way too cool. It's super interesting. It kind of affirms some of the things that I thought about in my own experiences in recovery and in life. But I've just never had someone I can actually like speak the science with, uh, or at
Mhm.
least explain like, hey, this is kind of how it feels up here. Like, what does that mean?
Uh-huh.
And so it's cool that we have those two brains inside of our one skull, and one is in charge of one thing, and the others in charge of the others, and it's just super fascinating. We can go on and on and on about this, but we have a few minutes left. Are there any shout outs you want to do for any of your socials? We got your book on there. Anything else?
Um, Not that I can think of. We post some on Instagram and Facebook, but I think to really get an understanding, you need to do a little reading.
Mm-hmm.
Yeah.
Um, so can we look at possibly getting you on the show again in the future so we
Of
can?
course, yeah, I'd love to. Yeah.
Okay, sweet. Hopefully by then I'll have finished your book, and then we can actually get into the jargon of it, because that would be really cool. So, um, Dr. Fred Schiffer, uh, dual brain psychology. This is interesting stuff, folks. Y'all better get the book, check it out, read it, and I'm super glad we got to do this because I'm pumped up. I'm just ready to get on Wikipedia and start looking stuff up while I'm waiting for the book. So, um, whenever I think of dual brain, though, I still think two brains, and you're right. I'm just going to have to remember that one plus one equals two, but then two is still the one inside my head. So I don't know what that is supposed to mean, but for some reason it just made sense. But anyways, we've reached the end of the episode. So for any of the links, again, we'll post them down there, and we'll see you in the future. But I don't know. I just feel like there's a whole lot left unsaid because there is a whole lot left we have to talk about. Um, but do you have any final words for the audience?
um, uh, I just thought that I do have a website. It's called
Oh,
dualbrainpsychology.com,
okay.
and there's some information on there. Um, and I think that this work is very helpful to people who want to
Okay.
improve their mental well being.
Sweet. Well, anyone that is wanting to check out that website, that will also be in the episode description. So I just highly encourage everyone to hop on the train and check out Dual Brain Psychology because this is going to be one awesome ride. So, Dr. Fred Schiffer, it has been an honor and a pleasure to have you on the show, and I
Thank
can't wait
you.
to have you back on.
I've enjoyed it. Thank you. Good. Great. Okay.
Thank you. And for all the listeners out there, y'all have a good rest of the day and be sure to check us out next week on WDJY 99.1 FM.